Chairperson. We have Secretary Dr. Francisco Duque III. We have Yusek Rolando Enrique Domingo. We have Yusek Roger Tong-an. We have the Assistant Secretary, Ms. Maria Bernardita Flores. We have the President and CEO of the Philippine Health Insurance Corporation, Dr. Roy B. Ferrer. We have the Director General of the Philippine Institute of Traditional and Alternative Medicine, Alternative Healthcare. We have Dr. Annabel P. de Guzman. We have the Executive Director of the Commission on Population. We have Dr. Juan Antonio Perez III. Then from the National Kidney and Transplant Institute, we have Dr. Rosemary Rosetta Liquite. And from the Philippine Heart Center, we have Dr. Joel Abanilla. From, we have the EVP and COO of PhilHealth, we have Mr. Ruben John Basa. Then from the Philippine Children Medical Center, we have the Deputy Director Vicente Gomez. That's all, Mr. Chair.
Okay, thank you. Anyway, before we continue, the Chair would like to acknowledge the presence of Senator Risa Ontiveros. And we will just wait also for the Senate President, who has some concerns that he would want to bring out this morning. And likewise, it will be nice, it will be good also if we can discuss also the implications brought about by the budget cuts by the DBM, especially on the HFEP and the HRH. So it's better that the leadership is present. No? Majority Leader Senator Mig Zubiri will likewise be joining us, and as the Minority Leader. So all the leaders of the Senate will be here this morning. So at least we will have ample support once we get to the plenary in trying to restore the budget of the Department of Health. Okay. So before, while we are waiting for the Senate President who was here earlier, probably my colleague would like to, Senator Risa, do you have any concerns?
Thank you, Mr. Chair, at magandang umaga po sa lahat ng ating mga, siguro isa sa mga paborito nating grupo ng resource persons, no, Mr. Chair. So aside from some follow-up questions I also have about the HFEP and HRH budget restoration efforts of the Chair, supported by all the members of the committee. Siguro po, Chair, ilang mga tanong pa sa PhilHealth, yung akin namang paboritong agency attached to within the health family. So yung isang unang tanong, Sir John, in your presentation during the last Oversight Committee hearing, so hindi po ito nung budget hearing, no, yung Oversight Committee hearing, you reported that for the sponsored category, which includes the point of care program, you pay out 4 pesos 9 centavos for every 1 peso received, and the benefit expense is 12.28 billion from a premium income of 3 billion pesos. Tama po bang sabihin ko na itong ratio na to nag-a-apply lamang sa 3 billion peso budget para sa special provision na entitled Attainment of Universal Coverage na nandoon po sa loob ng ating 2017 budget? Tama po ba yon?
Good morning, Mr. Senate President. Good morning, Mr. Chair. And good morning, Madam Senator. Yes, ma'am, Your Honor. The statement po is correct.
Thank you, Mr. Chair. I'll turn it back to the Chair first dahil nakabalik na po ang ating SP, and we will follow his lead on the next questions. Thank you, Mr. Chair.
Well, I was going to take up something else, but now that Senator Ontiveros has mentioned about PhilHealth, let me start off with the issue on PhilHealth. Mr. Chairman, thank you very much for this opportunity. I understand that you almost had a closure already of the budget hearings, no, for the Department of Health, but you were able to suspend it so that we may post some of our issues, concerns on the department. And in this case, let me start off with PhilHealth. Uh, the PhilHealth has recently been in hot waters, so to speak, due to the anomalies now in the agencies, all right? Now, including the recent COA report, which says that the PhilHealth has 4.75 billion net loss in 2017. Can you enlighten us on this COA report muna?
Mr. Chairman, I think the question will be most appropriately addressed to the acting president and CEO of PhilHealth, Dr. Roy Ferrer.
Good morning, Senate President and Chairperson and Senator Risa Ontiveros. The loss that has been reported by COA by as much as negative 4.7 billion as of December 2017 FS was revalidated by our fund management officer and the auditor of PhilHealth. And when we revalidated these figures, it came out that it's not loss after all. The loss was converted into $500 million pesos surplus or net income. So the details will be, of course, supported by, again, by the COA, but this is actually revalidated by PhilHealth and Department of Finance.
Do we have the COA here today? I would want to take your statement at face value, but it's not as easy as that. No?
Yes, I believe
We were
it's not
talking
easy
of
as that.
4.75 billion pesos na sinasabing loss. Sa amin dito sa Senado, at napakatagal ko na rito, we distinctly remember that some years ago, you had 22 billion surplus. Meron kayong 22 billion na savings during that time
When was that?
There was a time that you had that. Anong nangyari? Every year, kumukolekta kayo. Paano biglang naging loss kayo? Yes, Secretary Duque.
Yes, if I may, Mr. Chairman, having been a former president and CEO of PhilHealth, on the specific issue of the purported 4.4 to 4.7 billion loss, it is actually on account of a double entry that was made by the National Capital Region in terms of the benefit payouts. So it was I would be the first one to say that there was a carelessness in the way the reporting was done. Pareho-parehong amount, dalawang beses ipinasok.
Carelessness of who?
Of the NCR head that was responsible.
NCR head of who?
Ng PhilHealth.
DOH o
No,
PhilHealth?
PhilHealth.
Ano,
PhilHealth
PhilHealth?
lahat ito. PhilHealth ho lahat ito, Mr. Senate President. So, ito na nga ho yun, subject of the revalidation that was mentioned by the acting president. And we will have the COA also validate this revalidation done by PhilHealth and of its internal auditors. So we will give the full comprehensive report from how this was brought about, the double entry, and that it is really wrong to begin with as per accounting and auditing rules. So this has to be corrected, and I think the correction has been made. And in fact, the latest report is that instead of a loss, there is actually a gain of about roughly $500 million or 500 million. Whereabouts, Mr. President?
Yes, Mr. Chairman, we will expect the report, no? We would like to require a full report from COA and the PhilHealth on the explanation that they are giving, so that we may be clarified on the matter. And we will find out if this is accurate or not. Now, personally, I would not have minded saying that if COA says that you have meron kayong pagkukulang or because of anomalies you are suffering a loss. Ano? Okay lang sa akin yan kung walang nagko-complaint tungkol sa PhilHealth. Kaso napakaraming complaint. Ang number one complaint, itong mga hospital associations, ano yung sinasabi may utang kayong 6 billion sa kanila?
This is can I answer that, sir? This is in reaction to the recent pronouncements of Dr. Rustico Jimenez, President of the Private Hospital Association of the Philippines Incorporated, in which he again alleged the PhilHealth still owed their private hospital members of some 6 billion in unpaid claims from 2011 to 2017. We vehemently deny the said claim of the PHP president. From 2014, we started reimbursing claims using the 4 million claims by healthcare providers filed for the services they rendered to our members nationwide and even those abroad. For the current year, we have a total of 1 million in pending claims on record, of which close to 800,000 claims, or some 70% amounting to 7.3 billion, are well within 60 days processing time as provided for by law. We strongly belie his allegations that PhilHealth reimbursed hospitals from 5 months to a year because, based on our records, as of October 2018, our average turnaround time of claims processing nationwide is already at 33 days from the time that claims are received at our regional offices or branches. There's only one region that we are actually concerned with, that's Pro 7, which actually the hospital there are always complaining of delayed turnaround time. But we address this. There's a leadership problem. It is rather unfortunate that despite our constant communication with PHP, in fact, the
Leadership problem with who? Sinong leader?
sa PhilHealth po, sa Regional Vice President, Pro 7, constantly we are telling him to improve his turnaround time of claims processing. And despite the other region, with an average of 33 days, in fact, sir, ang ibang region nakakaabot na ng 8 days, 10 days. Ito siya, naka 90 days pa at more than 100 days. Kaya naapektuhan yung processing ng operation ng hospital. At dinagdagan na namin ng tao, adjudicators and encoders, para mag-improve yung turnaround time. Nag-improve nga, pero pag-alis ng mga tao na nilagay namin doon, bumalik na naman sa kwan po, sa dati. So there's a problem with this guy. So actually, we called his
What are you
attention.
doing about this guy?
Yeah,
Katulad na sinasabi kanina about the
in-address na po
NCR.
namin.
Why don't you remove him? Why don't you fire him?
Actually, we did now, sir, and we have a process of doing this legally. We send him papers, but now he's not receiving the papers, so we had the kasi ayaw niyo yung tanggapin yung charge na paper po, but the employees receive it, so we will suspend him, then the trial will proceed po.
Right, because also I have an issue with Region 7 shortly.
Yes,
no, but
that's,
so let's go back to the 6 billion so-called allegation of the Philippines.
There's no
the
truth
association.
actually
There's no
with
truth that. So how much payables do you really have?
siguro sir,
Magkano
roughly,
talaga utang nyo?
ito sir, kung sabihin natin, yung crude claims, that will include the return to hospital because lack of requirements, processing, and bad claims. Roughly mga 1 billion, sir. But 1 billion pesos, sir. Denied dito, sir. Pero hindi 6
So
billion.
roughly to the private hospitals, roughly 1 billion ang matatanggap ninyo na
Denied
payables
dito,
ninyo.
sir. Denied, sir.
And
Ibig
how
sabihin,
long? Oh.
ito yung pinakabago na, kwan, sir, na data namin po. 1
Okay.
billion, but not 6
All right,
billion as to...
and then give our committee an update on the
Yes, sir.
situation of that particular person you're talking about.
Yes,
What is his assignment and designation?
Me, sir?
No, the person that you talked about in Region 7.
He is the regional vice president, but now we will be coming out on an order that he will be suspended for 90 days, and then somebody will take his post to fasten the processing of claims, sir. Somebody will take his post.
And he cannot do something about that, like what he's doing now, not accepting, not receiving your
Meron na po, sir.
summonses?
May witness na po tayo at ilalagay na po namin ito sa Outlook. Magiging kwan na po ito. Effective today, he will not be the regional vice president. Somebody will take his
Good.
place.
All right. Let us know if you cannot do it, because
Yes, sir.
if you cannot, we will abolish his office.
Yes, sir.
Therefore,
We are
he has
presenting,
no
sir.
longer-
Soto, napakalaki yung collectible, sir.
Correct.
I was there. I even went there and then check it out. And true enough, there was malaki yung collectible, sir. And
The
then,
committee can simply abolish his office by removing the budget for his office. It's as simple as that.
Yes,
Kaya
sir.
kung ayaw sumunod, sabihin niyo sa amin.
Yes, sir. Yes, sir.
All right. Now, still on the issue of PhilHealth, kasi just this year, early this year, there was a public hearing of the Universal Healthcare Bill in Cebu, in Region 7. And the municipal health officers of Cebu, raised the issue on capitation fund. According to them, they were able to deliver their health services adequately in 2013 to 2015 until they were given a zero capitation fund in 2016. So the PhilHealth portal was installed in 2016 to generate reports. Di ba? Now, however, according to them, the system failed. So the health workers submitted their reports manually. They sent it 3 times as PhilHealth asked them to resubmit. Now, despite their compliance on their end, PhilHealth gave them a zero capitation fund in 2016 and only 5,000 pesos for 2017. So you perhaps know Ms. Soria of PhilHealth. She said that this must be a system issue. And then Mr. Chavez of PhilHealth said that this is an IT issue. Now, according to Congresswoman Helen Tan of the House of Representatives, who was with us during that time, this issue is happening all over the Philippines and not just in Cebu. She is from Quezon. So can you explain to us what is happening here in this capitation fund, and clearly disrupts the delivery of services to our countrymen, and more particularly in my region, Region 7
Yes, sir.
in Cebu.
Yes, sir. With your kind permission, I will let my COO answer this question, sir.
Good
Yes,
morning, Mr. President. Yes, sir.
yes,
Jan
sir.
Basa po.
Director Basa.
You were right, sir, that's in saying that the delays in the releases of the capitation fund were brought about by the move our move towards electronic claim submission of claims from the manual submission of the claims. But yesterday, recognizing the problem, the President gave instructions to the EXICOM that within 4 weeks, all of the capitation funds should have been addressed and released. So we expect that the capitation funds would be released before the end of November, sir.
President who?
Dr. Roy Ferrer po.
All right. Only yesterday.
It has long been discussed, sir, and last week we had a meeting. Our point persons from PhilHealth met with the K-mates of the Department of Health to look into how can be fast-track yung transmission from the rural health units that were transmitted to the third-party IT provider to DOH and then to PhilHealth.
All right. Again, also please submit to us a report
Will do, Mr.
on how
President.
is this being handled, and we will furnish also our friends in Region 7, no? Your health workers who are complaining.
We will, Mr. Senate President.
All right, thank you. Now, the Universal Healthcare Bill, we've already approved it, and my question to the Department of Health and the PhilHealth is, the media was asking me earlier, are you ready to implement this program?
Yes, sir. We're ready to implement it, but this is no magic bullet, and this is not a panacea. This is something we can't and we must not promise the moon and the stars, Mr. Chairman. The first year of implementation will show some kinks in the implementation, but as they say, we have to learn from the lessons that the gaps will present when the first year of implementation is made. And so the only problematic area that I can see is the lack of funding for year one. We need at least about 257 billion, Mr. President, to run the UHC on its first year. But then again, the absorptive capacity of the DOH has to improve, and we are working towards improving our absorptive capacity. But if the question is, are we ready? Yes, we're ready, but whether the systems are perfect, they're not, because in fact, we need to tweak, we need to expand, we need to level up, we need to do gap assessment, we need to see where the weaknesses are. And right now, we already can see that the difficulty will be implementing this in the rural, geographically isolated, disadvantaged areas, as well as the rural non-GIDA areas, where there's a paucity of health facilities with the appropriate or adequate capacity to provide healthcare services in general, and in particular, the primary health care.
All right. What about your health workers? Are they ready for the program?
Right now, I would like to report to the committee that the problem initially presented about the huge cut in the HR budget of the DOH, this problem is already solved, and the budgetary support has been restored for, in fact, a bigger number of human resource for health complement from about 26,378 JOs and contract of service workers to about 28,000. So that's no longer a problem. We can sleep well knowing that that has been resolved. However, what needs to be resolved is the budget that underpins the health facility enhancement program. Originally, the DOH has requested about 30 billion, but this was reduced to 50 million. And the 50 million is not really for HFEP, it's really for leveling up the technical capacity of the concerned offices of the DOH, such as the HFEP, to make an assessment of all of the infrastructure projects of the DOH, Your Honor. And so the huge cut will certainly affect the ability of the DOH to complete and operationalize these infra projects, especially those which are already 100% completed, needing only equipment, constituting priority 1 in the list that we have prepared. However, for the priority 2, there's a list of facilities which are 90% completed, but we need to fund the 10% remaining. And the same is true for priority 3, where we have 80% completed infra projects needing 20% support, budget support to cover the deficit. And also for priority 4, it's 70% completed and 30% needs to be funded. So the good secretary of the DBM had asked me to submit a catch-up plan. The catch-up plan has been submitted and includes a 16 billion allotment or appropriation precisely to address the priority infra projects that that can be completed within a 1-year time horizon, Your Honor.
All right, so can we safely say that the department is ready to absorb the budget on top of the regular budget and completely obligate and utilize the same for the universal health care program?
The particular issue of HFEP, the concerned offices and the technical units of those offices have confidently expressed to me that the 16 billion, if and when this will be reinstated, this can be absorbed by the DOH, and the outcome is really a many more completed health facilities. And with the end in view of fully operationalizing this so that the purpose for which they are built is satisfied or met, and the patients themselves will benefit from this. And this is complementary to the overall strategy of the service delivery networks, which form part of our universal health care. If I may, Mr. Chairman, and very quickly, the pillars of the universal health care.
With the indulgence of the Senate President, probably Secretary Duque, can you expound on what will be the implications if the budget cut really happens? So kung hindi na ibigay yung 16 billion that you are asking now for the HFEP, so that the Senate President would have a better appreciation of what the implications would be or the effect on the different health facilities, as now that we are about to implement the universal health care. And as you mentioned, part of universal health care is the improvement of facilities and the service delivery network. So probably which hospitals will not be functional, yung mga 90%, 80% completed. So what will be the implications?
Well, negatively, this will impact on the ability of the DOH to provide services, hospital care services, and also certain services at the lower level facilities. And so this is certainly bad, and our people who expect the universal health care to be implemented next year, it is quite ironic that when the bill is to be passed into law, and then we have problems of inadequate funding. Although, of course, we understand the position of the DBM, and that consistently they have observed and brought to our attention the poor absorptive capacity. So we would like to address this squarely by putting in the right systems and the technical support that will help us address the weaknesses. And the weaknesses begin all the way from the stage of planning, because it's in the planning where everything must happen, so that you more or less will have a much better execution or implementation of the program. Because, bad planning equals bad execution. So the planning stage has to be done in such a way that all the concerned offices, all the stakeholders, everybody must be given a chance to really be part of the planning of our service delivery networks. And so, Mr. Senate President, Your Honor, we really would need the support of the Senate and the Congress in general to help us restore at least 16 billion. Although, of course, the good secretary has already, he said for me to submit a catch-up plan, and we did. And we'll have to get a feedback from the DBM secretary as to how they will resolve the matter. So in probably just a few days, we'll get the feedback.
What about during the budget deliberations of the House of Representatives? Were you able to infuse that?
The House has effectively restore 3 billion of the HFAP, which is obviously inadequate. And also another 3 billion for the HR, but given that the HR issue has been resolved, so the matter of the 3 billion being restored for HR has been mooted by the decision of the DBM that, number one, the JOs and the contract of service employees will continue, and in fact, the contract of service will be extended all the way to 2020, and the JOs, their annual or yearly contracts, together with the contract of service employees, will be renewed. And we will submit this, and the funding, the entirety, will be charged against the miscellaneous personal benefit fund, which is essentially a pool of savings from unfilled plantilla positions, which the DBM has parked, and that this will be the source of funding for the HRH deployment program of the DOH that will require about 28,000 employees.
And what would be the total amount for that?
The total
What's
amount
set
would be about
aside?
16, 17 billion, Your Honor.
So, how much was cut from the NEP, the proposed budget?
Well, the total for HFAP is about 30 billion. They just they just retain 50 million, which is really not an HFAP budget. And then that's about it, Your Honor, Mr. President.
30 total?
30
talaga?
billion,
30,
thereabouts. Yes,
30 billion. And you're looking at 16, 17 billion, that's possible? No?
yes, sir. Just to
Then
catch up.
We're just to catch up.
Yes, sir.
And then we're looking, therefore, we're just short of about 13, 14 billion. Is that what the Senate should watch out for, so that we may be able to restore the
There's
entire
already,
30?
yes, sir. It's less because there's already 3 billion restored in the House. So that's another
3,
14.
tapos 3, tapos yung 17, palagay nyo. So 20. You're looking at 10. All right. The chairman of the Committee on Health is aware of the fact that we uncovered an issue in the House of Representatives that that involved 55 billion. And so it's nowhere now at the moment, and I know that it is going to be used properly. So perhaps we will be able to get 10 from that and put it in your budget, all right, to complete your the lock. All right, now, moving on.
Mr. Chair,
Yes.
SP, with the indulgence of the good SP, just to follow up the last point of the SP on the restoration of the HFEP budget. So nag-update nga po, Mr. Chairman, si SEC na the House has restored 3 billion, but what was originally removed from the DOH's HFEP budget was actually 16 billion. Sorry, 30. So ang kulang na lang ay 27. So I'd like to seek your advice, Chair, and the advice of the SP, if don't we need to restore a bigger amount, even bigger than 10B?
But
in the
siguro,
Senate version,
with
Mr.
the
Chair.
indulgence of Senator, Sec Duque, yung how much would be acceptable for you na you think will be that amount that would you'll be able to complete yung mga 80%, 90%, and even 100% na magkakaroon naman, at least mapapakinabangan na ho natin yung mga facilities so that we will have a better, our colleagues, the Senate President is here, that at least we will have a better understanding of yung you think the figure that you would need to at least magamit po yung mga facilities.
The figure, as I have indicated, Your Honors, is 16 billion, 16.7, 16.8 billion. That will now be applied for completion of Priority 1 projects, 100% completed, infra needing equipment. We're talking about 900 facilities here. And then the Priority 2, 90% completed, we're talking about 93 facilities here. And then Priority 3, mostly barangay health stations and DOH hospitals, which are really critical for the implementation of the universal healthcare. You're talking about 235 facilities, and then Priority 4, 91 facilities, and then for Priority 5, infra or equipment projects for enhancement of the service delivery networks, enhancement lang po to, we're talking about 93. So this is a significant number, both from the value side and actual number of facilities, and this will really impact on the ability of the DOH to implement, at least in the initial year of the UHC run, to really effectively provide these services. And if we don't get this budget, this will really undermine our ability to provide such services.
So, Secretary Gier, in fact, you're saying that with the budget cuts that will we are facing right now, in case we're not able to restore, it will definitely affect the implementation of the universal healthcare because of the service delivery network. So, without the 30 billion or even the 16 billion restored, implementation of the universal healthcare in its first year will definitely be affected.
There will be a setback. The Secretary Jokno has said that the cleansing, so to speak, the catch-up for 2019, then he will restore everything by 2020, which by then will be the second year of the UHC implementation. But the compromise budget level is really about 16, 17 billion.
So, Mr. Chair, what I hope the SEC can completely advise us on is in response to the earlier recommendation of the SP to restore by at least 10B from that bigger amount that we saw in the original House budget. Would that be enough, or would you in fact request to restore it, the HFEP item, by up to 16? That's my question, Secretary.
If the House has already, I don't know if it's the correct term is realignment 3 billion, then we effectively need 14 billion. That will more or less allow us now to complete all the priority projects as listed.
Yeah, well, all right. During the period of amendments in the Senate, perhaps we can discuss this with the chairman of the Committee on Finance, and of course, with the help of our chairman here of the Subcommittee on Finance, which handles the budget of the Department of Health, Senator Ejercito. And of course, with the help of the members of the minorities, headed by Senator Ontiveros, we'll be able to do something about it, I'm sure. Now,
Thank you very much, SP. At
Alright.
maalala po ninyo, nung nandito si Minority Leader, gaya ng as as SP has referred to, pinamalas din po niya yung suporta namin ng buong minority for the restoration of the DOH budget. So, salamat,
All
SP.
right.
Thank you, Mr. Chair.
Thank you. Now, moving on, Mr. Chairman, with your indulgence. I have a very particular concern about a subject matter which involves Tarlac. I'm now the acting chairman of the NPC. Our chairman emeritus is from Tarlac. So this is just like a disclosure, na we're concerned about this particular issue. Are you familiar with Dr. Farah Agustin Bunch?
Mr. Chairman, may I refer the matter to USEC Eric Domingo, Mr. Chairman, with your permission.
Yes, Yusek Domingo.
Yes, sir,
You
Mr.
familiar
Chair.
with her?
Yes, sir, I'm the head of the health regulation team of the Department of Health, and we are aware of the case of Dr. Farah Agustin Bunch.
You're very much aware of the fact that you granted her, the FDA granted her a license to operate and all that. No?
Yes, Mr. Chair. See, apparently until June of this year, Dr. Farah Agustin Bunch had a license to operate as a manufacturer of food. Your Honor.
Yes, but all of a sudden, the FDA issued a closure order on Dr. Bunch's Natural Medical Center, and her product has been previously registered with BFAD under his father's name. It has been tested by the University of the Philippines and St. Luke's Medical Center. It was found to kill and reduce the growth of cancer cells by 50 to 80%. But all of a sudden, there is a group of medical societies complaining about her, or ano ba itong ano nila?
Yes,
Yes,
Mr. Chair.
go ahead.
The Dr. Farah Bunch had a license to operate as a food manufacturer. However, in May, the FDA received some complaints regarding a patient who died while apparently admitted at the center. And the FDA and DOH checked, and the center had no license to operate as a medical facility. The FDA had never granted a license to operate a pharmacy, and none of the products that were being sold were registered or had a certificate of product registration. So there was an investigation done, and what was closed, sir, was the pharmacy because it was not a licensed pharmacy, and the products that were not registered were confiscated.
You know, this case was brought to my attention by cancer patients of Dr. Farah who greatly benefited from the services and the product, the so-called product. They personally testified and how this Boston Sea product helped them. So I believe time is of the essence to find out more about this case because they feel that their lives are all at risk, and there are many patients who have benefited from this. Baka merong nagrereklamong mga, ano ba yung mga nagrereklamo? Mga medical societies ba ito?
Yes, Mr. Chair. The complaints were from the medical societies, the oncologists, and then some patients. And I believe, sir, there was a meeting between...
Who are these patients? Who are these patients that complained?
Sir, we can send you the list. I do not have it
give
right
us,
now.
because
Yes,
according to the reports that we gathered, the medical societies were the one complaining. No? There is no patient who has complained. Kasi kung maganda benepisyo, maganda nagiging resulta, registered naman sa inyo, lisensyado siya sa kanya, may nagrereklamo mga medical societies, ina-address nyo kagad. Bakit yung mga albularyo hindi nila nirereklamo? Bakit yung marami nakikinabang nirereklamo nila?
Mr. Chair, we have a Philippine Institute of Traditional and Alternative Healthcare, and they do set standards for alternative healthcare. But in this case, because it was being sold as a medicine, it requires a certificate of product registration. And I think there was a meeting between Dr. Farabanch and then the FDA, and the agreement was, of course, for Dr. Farabanch first to settle and pay the fines that have been imposed, and then she may again apply for a license to operate a pharmacy and registration of her product so that they may be sold to the public, Your Honor.
All right, we'll take your answer to that, no? And we'll give that particular answer you gave to the people in Tarlac who are asking about it, no? And we'll discuss it further with Secretary Duque at a proper time. Mr. Chair, I suspend my questions at the moment. I will just check on what I have left.
Thank you, Senate President. Senator Tiveros would like to continue with their concerns.
Thank you, Mr. Chairman. At saka dahil nabanggit na rin ni Yusek Domingo ang PTAC, salamat sa pagbanggit na iyon kasi PTAC is one of the agencies I appreciate the work of, yung pagpapakilala nila sa mga traditional and alternative paths to healing at healers dito sa Pilipinas. At the same time, yung pagsusumikap nilang magtakda ng mga standards that are per the standards of the health department as well. Naging partner po namin ng PTAC a long time ago sa pagpasa ng cheaper medicines law. So salamat po sa presensya nyo. So thank you, Chair. Just to continue, tapusin ko po yung mga concerns ko sa PhilHealth. Sorry po, Dr. Ferrer, hindi ko kayo natanong agad kasi nasanay ako magtanong kay Sir John. So to continue, no? So kinonfirm kanina na yung ratio nag-apply lamang dun sa 3 billion peso budget sa special provision na attainment of universal coverage na nakapaloob sa 2017 budget. Kung ganun, meron bang similar measure or ratio ang PhilHealth? Kung magkano ang binabayad nyo o pinipay out for the sponsored program na identified through the NHTS PR, para saan inappropriatean ang PhilHealth ng budget ng 37 billion sa parehong taong 2016 at 2017. So are we talking about the same ratio here? Paying out about 4 pesos for every 1 peso received, and then, ayun po.
Good afternoon, Your Honors. With the kind indulgence of our acting president, as regards benefit payments for the sponsored program, our collections, our premium as budgeted in the General Appropriations Act is higher by about, the ratio is about 80%. So mas mataas po ang collections to benefit payments, but that would take into account our primary care benefit package, which we have expanded, which we have initially rolled out for our indigents to ensure that our members in the program would no longer need the expensive hospitalization. And for we are increasing the capitation, the primary care benefits from 500 currently, from 500 to about 800 pesos by next year, to further expand the benefits that our indigent members are receiving currently right now.
So tama po bang sabihin na yung ginastos nyo for benefit payouts para sa NHTS, given premiums of 37 billion in 2016 and 2017 ay nagkahalaga ng mga 21.2 billion pesos mula sa collection ng 33.8 billion at least sa 2017?
That would be around that figure, Your Honors, but that would we expect to increase it once we, as earlier discussed, complete the payments for the capitation and the primary care benefits.
Dahil ini-increase nyo yung capitation from 500 to 800 pesos.
Yes, Your Honor.
Okay. Pwede nyo bang bigyan ng insight yung komite namin on kung bakit yung benefit payouts para sa sponsored program ay Much less nga ba ng premiums allocated sa GAA? Unang-una, meron ba kayong data sa proportion ng NHTS families sa sponsored program, estimated to be about 14.7 million, na nakapag-avail ng PhilHealth benefits para sa 2017 at saka itong unang kalahati ng 2018?
Your Honor, we have the figures for that one, but one of the reasons for the higher benefit payments than collections for the indigent sector is majority of our indigents would choose to go to government facilities, wherein the cost for the healthcare is lower than the counterparts in the private sector.
And I suppose dahil nga din yun, kaugnay dyan yung makapag-avail of sila ng no balance billing sa ating mga government o
Yes, Your
public
Honor.
hospitals. Sige, mamaya po meron din akong ilang mga tanong doon. So yun po, kasi salamat dun sa mga pagsasagot kasi gusto kong maunawaan bakit mukhang hindi tayo gumagastos ng mas malaki para sa benefits nitong membership category. Sa ilalim ng Universal Healthcare Bill na napag-usapan kanina ni na Chairman at SP, we are moving towards the simplified membership categories. At gusto po naming siguruhin na yung eventually magiging bahagi ng indirect contributory members ay magiging mas sapat din na mapoprotektahan. It may be possible that to wander along with you, no? It may be possible na yung considerable number ng NHTS families ay malusog nung taong iyon o nitong nakaraang isa't kalahating taon at di sila pumunta sa ospital o clinic para mag-avail of ng health services, pero medyo unlikely din given payouts sa ibang membership categories. At mas tinukoy mo nga yung dahilan na mas sa government hospitals talaga sila pumipiling pumunta. Maaari ding itong mga pamilya hindi sila aware na actual members sila, yung makasaysayang problema natin dyan, o baka hindi sila nag-avail of kasi alam din nila yung mga out-of-pocket expenses na maaaring incur sa prosesong yan. So, ano po yung mga hakbang, just as my last question on this topic, ano yung mga hakbang ninyo para i-increase yung availment ng PhilHealth benefits sa mga sponsored members na nakapaloob sa NHTS?
Your Honors, our communications and our reach out to the local communities are ongoing. Every region are doing their Alagaka campaigns. And our President has been witness and has been gracing majority of these Alaga campaigns. So you might want.
Okay, salamat Mr. Chair. Dako naman po ako dun sa isang chinampion din ni Senate Finance Committee Chair Lauren mula nung nakaraang mga taon, yung supplemental benefits for the executive branch. So Special Provision number 3 ng 2018 GAA ay nag-provide din ng supplemental benefits para sa mga government employees ng executive branch. Itong supplemental benefits shall cover healthcare services, preventive and curative, inpatient and outpatient, and other medical expenses in excess of contributions-based case rate. Maaari po bang malaman ano na ang status ng programang ito? Ito ba'y pinatutupad na? At ano pa ang kakailanganin para ganap itong maipatupad ng PhilHealth?
Yes, Your Honor, this PhilHealth supplemental benefit, which appropriated an amount of 3.5 billion pesos for this PhilHealth Plus, will be rolled out within the next 2 weeks, yes, this month. And it shall cover the cost of supplemental health benefits of government employees of the executive branch, shall cover health services, preventive and curative, inpatient and outpatient, and other medical expenses in excess of contribution-based case rates po. So, next 2 weeks po, lalabas na po ito.
Salamat po. It's good to know na sa wakas mairo-roll out na ito sa lalong madaling panahon. Kasi sayang naman itong dagdag benepisyo para sa mga kawani ng ehekutibo.
Apo.
Dako naman po, Mr. Chair, dun nga po sa no balance billing. Maaari bang malaman kung paano nag-arrive at ang PhilHealth sa bilang na yung di umano yung batay sa presentation noong 2017 na yung compliance sa NBB para sa indigents at iba pang sponsored program members ay nasa 73%. Paano po nakwenta ito?
Baha po natin itong survey na ito conducted by our PCare staff. And mula po ng 2017, from 72%, nagkaroon po tayo ng 80%. No? So that's actually 84% ang taas po. So from 2017 to 2018 po, availing the no balance billing po sa government hospitals po.
Well, batay din po sa data, sa mga ulat na sinamit ng PhilCare sa iba't ibang ospital, marami pa rin daw ang di nakaka-avail ng completely ng NBB policy ng PhilHealth. Well, based dun sa sinabi nyo kaninang 84%, medyo significant minority pa rin ang 16%. Marami pa rin daw ang nakararanas ng paglabas ng pera pag na-admit sila sa government hospital. So yun na nga pong out-of-pocket expenses. Mari bang humingi ng technical document o report tungkol sa data na ito?
Yes, ma'am. We will submit it to you. And I think itong 16% will be covered by the malasakit centers that was established. And I think it's rolling out in different government hospitals, in a DOH retained hospitals. So we really can truly get that no balance billing with the help of the malasakit centers.
Well, actually, Mr. Chairman, mas interesado ako na makover o makapag-comply ang PhilHealth ng 100% sa
Opo.
no balance billing.
Actually po,
Ah,
dapat ang PhilHealth po zero balance billing
exactly
na po.
po. At 100% kayo po ang mag-insure niyan. At hindi po tayo kailangang umasa sa malasakit center, ano pa mang ibang center bukod sa PhilHealth. Lalo na't ang interest po natin, lalo na sa universal healthcare, ay institutionalization ng health financing at health insurance. At hindi may mas spin-off na mapoliticize pa na anumang ibang sentro. Ako, ang interest ko lamang ay PhilHealth talaga. Yun ay sasapat na sa loob ng DOH.
Opo. At tinatrabaho na po namin ito with the Department of Health, particularly yung mga listahan ng mga gamot na dapat po yung na-prescribe na gamot na sa loob ng butika ng hospital. At hindi lang po ito, pati yung mga instruments po. So, ma-availo talaga ng pasyente po at ang pangangailangan po nila sa loob ng hospital. So, yung mga prescription po, nalabas po, kasi hindi po nakikita sa loob ng hospital. Pag nakumpleto po itong mga gamot at mga instruments sa loob ng hospital po, sigurado tayo no balance billing po.
Mr. Chairman, can I just add to the response of the PhilHealth head? That's why one of the major challenges in the universal healthcare, Madam Senator, is really the consolidation of funds from PAGCOR, from PCSO, from DSWD, and in fact, quite ironically, even the DOH MAIP. I think we really have to put them under one roof for purposes of more efficient and effective administration of the funding of UHC. And that is why it is very important that we get your support, and which already, by the way, approved, is really to consolidate all these fundings under one roof, and that has to be PhilHealth as the major payer of benefits to its members, and therefore this is something that, and also of course I take the opportunity to underscore the importance of the passage of the sin tax law, SICON, the supposed to be Trabajo 2. That's going to be a major source of funding for us to be able to roll out the UHC in year 1 and until about year 10. Dapat tuloy-tuloy may sustained funding. And also, let me just underscore another important point under the strategy of consolidation of funding is really the accountability. The problem today, Mr. Chairman, Madam Senator, is because people or patients go to many different funding sources, it's very difficult to find out whether they have asked twice, 3 times for one billing. And also, more importantly, it is going to be quite tedious for the poor patients to be going to all these one by one, these funding sources, where, there's so much traffic, the transport cost, and, the hassle ba. So either way, ang dami talagang problema that we have observed with these multiple funding sources set up, no, that we are currently operating. And so I think this has to change. Otherwise, we defeat the very purpose for why we created the law of the National Health Insurance Program, and now we're sliding back to the old system of many sources of funding, which can be politicized, for one, and then number two is very inefficient, and worst above all is the difficulty to account for all of those funds. So I really would like to stress this, and I take this opportunity today to emphasize this point. Thank you.
Thank you so much, Mr. Chair and the good Secretary, for summarizing completely for us kung bakit napaka-importanteng maganap ng PhilHealth, ang papel ninyo na walang ibang kaagaw kasi kayo naman ay, yun na nga, by law, set up to deliver those services to your members. So, salamat po. Does PhilHealth have another mechanism for evaluating compliance of government hospitals to NBB? Gumagamit po ba kayo ng mga studies mula sa mga third parties, tulad ng mga academic institutions, civil society organizations, at development partners para dito?
Yes, Your Honors, aside from the studies from the PhilHealth Cares, we have commissioned outside academic institutions, the UP. Part of our research studies, we have a number of researches, and one of these is the validation of our NBB compliance. We expect, Your Honors, to receive the latest report by the last Monday of November. We have a forum for the PhilHealth studies, and the NBB compliance would be one of those that would be reported.
Very good to hear that po kasi maalala nyo po siguro na may long-standing na study group sa UP Diliman, pati sa School of Economics nila tungkol sa universal healthcare at yung financing nito. Panahon pa ng the late great former Secretary Kwasi Romualdez ay naging bahagi din po noon. Also po, meron po ba tayong summary o breakdown ng rates of compliance sa NBB per DOH hospital?
Yes, Your Honors, we have po, including LGU hospitals, we have po. We can
Okay.
forward it to your office po,
Yes,
and to the
please.
committee po.
You were reading my mind. Salamat po. The committee would appreciate that. Okay, second to the last for no balance billing. Nag-wonder din po ako kung anong mechanisms meron para tulungan yung publiko na i-hold accountable yung DOH hospitals for proper implementation. Yung compliance ba sa NBB policy o delivery of health services sa eligible beneficiaries with zero co-payment ay isa sa mga performance benchmarks ng mga ospital. Ito bang mga ospital may citizens charter type na dokumento na nag-affirm sa pagtataya niya na mag-deliver ng health services na may zero copay para sa eligible beneficiaries. At tanong sa PhilHealth pero sa DOH din, yung DOH hospitals kaya maging willing tumanggap ng isang panukala na isama yung compliance sa zero co-payment para sa eligible beneficiaries bilang isa sa major final outcomes ng DOH hospitals?
Yes, Your Honor, we're doing that. Well, in fact, we base our re-accreditation with the hospitals if they are not compliant with the NBB, along with the Department of Health, Your Honor.
If I may add also, Madam Senator, that's precisely why we have adopted in the performance governance system of the DOH, and in particular applying to hospitals, one of the major metrics that we have adopted is really the no balance billing. So the metric of performance is the NBB. Then we need to make sure that the 70-80% reported compliance of the DOH hospitals to NBB must reach 100%. And we are putting timelines, Your Honor, to make sure that we are resolute and that we want the NBB policy to be implemented fully, although with the caveat, Madam Senator, that sometimes the no balance billing may also sometime in the future face the burden of abuse, because in the many experiences of social health insurance systems worldwide, it has been seen that if there is no co-payment, then the tendency or the propensity to abuse is much higher, because the funding mechanism or the financing mechanism, which is the old one, which is fee for service, has some inherent advantages that it will dissuade or discourage people from accessing hospital care, even if there's really no indication. But now that it's all free, everybody says, oh, let's go and let's have ourselves undergo all of this. So there's just this bit of a caveat, but it's good to be mindful of that so that we can put also the requisite mechanisms precisely to counter that potential abuse under a regime of a no balance billing policy.
Salamat, Mr. Chairman. I'm sure nagsi-think ahead na ang DOH at ang PhilHealth paano iwasan yung ganung mga instances of abuse, which in any case, I would imagine, but I'm willing to be corrected if I'm wrong, na would happen in a minority number or percentage of cases in any case in such a system like PhilHealth. So, speaking of timelines, last question ko sa no balance billing. Assuming for the sake of argument na compliance sa NBB ay nasa 73% na o kahit 84% na, ano po yung target ng DOH at PhilHealth in terms of compliance to NBB in the next, say, 3 years? Ano po yung kakailanganin para ang PhilHealth at DOH ay mabawasan yung out-of-pocket spending sa mga qualified beneficiaries na inadmit sa designated NBB providers? So, are we going to hit 100% in the next 3 years? Ano po yung target?
I understand that the NBB target by 2022 should be 100%. We would have wanted it earlier, but there are funding limitations as well. Because at the end of the day, Your Honor, it's really implementing those policies, bearing in mind that we're operating with finite resources. So unless the adequacy of funding is addressed fully, it may be not prudent to advance the no balance billing policy 100% target before 2022. Yes, ma'am.
Fair enough, Mr. Chair and Good Secretary. In any case, baka pwede na lang i-advise ng PhilHealth ang committee ito kung year on year, ano yung progressive targets nyo going towards 100% sa 2022 para makapag-assist din kami, lalo na sa Oversight Committee on PhilHealth, na masuportahan yung PhilHealth na maabot yung ganitong targets. Isang tanong lang dun sa provider payment mechanism. So currently po, at naalala ko nung nasa board pa ako 4 years ago until 3 years ago, currently gumagamit ng case rates para tukuyin yung amount of reimbursement na entitled ang isang accredited health facility for treatment or management of certain conditions. At naalala ko kahit nung panahon yun, may mga initiatives na at least sa level ng pag-uusap ng management, pinopost nyo sa board noon, na simulan tignan yung, and I understood that even then this was supported by the agency, tignan yung diagnosis-related groups o DRG, hospital payment system, para itakda yung mga case rates. So, and isa rin ito sa areas of reform sa ilalim ng Universal Healthcare Bill. So, ganong kaaga ito maro-roll out kaya o may institute?
Yes, Your Honor. The work on diagnosis-related groups is ongoing, and we intend to fast-track it, particularly with the passage of the UHC. We see this as one of the major reforms that would be undertaken by the health sector, as it would address the current gaps in the provider payment mechanisms. And one of the key key factors is the gathering of data, which is the current efforts to for electronic claim submission would be fast track. We intend to have the pilot testing for the DRGs as early as first part of 2020, which is about a year from now, and work is ongoing for the DRGs, and costing, we intend to complete it by 2019, Your Honors.
With the indulgence of Senator Tiberos, I'd just like to ask PhilHealth, since we are about to pass the Universal Healthcare Program, hopefully by December, and the first year of implementation will be 2019, being the primary agency tasked to implement the Universal Healthcare, now we will be pooling the funds, and you will be the administrator of you will be the primary agency tasked to implement the UAC. Is PhilHealth ready? Considering that you had some financial problems a year ago, so is the agency ready?
Yes, sir. We are ready. And according to my boss, Department of Health, Dr. Duki, we are aligned with the Department of Health. And with regards to the fund, with the FS, we have a reserve fund of 120 billion pesos. Well, in fact, our net income is, the trend is going up. From June, we have a surplus of 7.3, then August, we have 10.3. I think September is 9.3 or 9.7 billion net income. So I think we are on the right track. And we are so aggressive with our anti-fraud measure, Your Honor.
I hope that, of course, no, yung mga fraud natin, no, that bleeds that's parang hemorrhage yan eh.
Yes,
I hope
yes,
that yung mga, what's this, yung mga fraud, yung mga, what's this, yung huli, no, yung
Casing.
aside from the cataract, or yung mga pneumonia natin,
Ghost sponsor.
upgrading, in-upgrade. So,
Yes,
casing.
casing po.
What have you done so that this will be controlled, no?
Our IT is so much improved, Your Honor. Well, in fact, we can see spikes, and we let the fact-finding investigation go to the area wherein there is spike. And of course, our claims, we encourage them to submit the data completely so that we can monitor if there are, ghost patients and inadequate laboratories that should supposed to be submitted. We're coming up with the CF4 or your claim form 4, which is actually more automated with so we can have this, we can catch faster those who are doing fraud claims, and the processing of claims is faster as compared with these other forms that we have now. We have some testing pilots na po in other hospitals, and we're getting the data. But perhaps first quarter next year, we will implement the CF4.
Yes, Secretary Duque, may want to add
Yeah, I just
something.
wanted to very quickly add, one of the major reform initiatives being pursued by PhilHealth is really the strengthening of our health information data analytics. This is what was referred to by Dr. Ferrer, where we just you just key in, and then you find out which regions, which hospitals, for example, has an outlier number of cases. An example would be if the benchmark for cases of cesarean section is 1:4, deliveries ought to be via CS. And then in the health data analytics system that we have put together at the PhilHealth, makikita mo may region, they're 3 in 4 CS. So you already find out there's an outlier. Then you can already pinpoint and attack that problem. That's number one. Then also one of the major reforms being carried out is really monitoring collection efficiency of PhilHealth, because this is a contributory system where employers are sometimes underreporting, and so with threat of legal action, we have sent across the message that PhilHealth is indeed serious in making sure that their liabilities, their contribution, counterpart contributions are remitted to the PhilHealth, so we can ensure the long-term sustainability, actuarial sustainability of the system, and at the same time, progressively provide improved benefit packages. So it's a balance between actuarial sustainability and benefit adequacy. But at the end of the day, it's the long-term sustainability which is the imperatives of a good working sustainable system.
Okay. Thank you, Chair. Ayun, at maganda rin nabanggit ni the Good Secretary yung health information kasi isa rin ito sa haligi, di ba, ng isang universal healthcare system, which the Good Secretary was enumerating earlier, the 6 pillars of a universal healthcare system. So maganda, yung isang pillar, health insurance or health financing, actually helps also reinforce another pillar. So moving on, Mr. Chair, isang tanong din lang tungkol naman sa mental health. Pahingi lang po ng update sa PhilHealth muli on developing enhanced benefit packages o case rates para sa mga critical mental health conditions. Naalala ko po nung oversight hearing ng komite namin under Chair JV also, sinabi po ng PhilHealth noon na may progress na rito.
Your Honors, we will submit the current works that have been made as regards the development of the mental health package.
Salamat po. Nabalitaan ko po kasi na binibid out na yung technical assistance para sa development niyang benefits packages. Okay, salamat po. Moving on sa cancer naman po. Last year, nagawa po namin na partially i-restore yung budget para sa medicine access program sa cancer. Maaari po bang humingi ng update sa status niyang medicine access programs? So, what cancers are covered by the program? Ilang mga beneficiaryo ang napaglingkuran na ng programa nitong taon? Ano yung status ng bidding para sa procurement ng cancer medicines ngayong taon? Lalo na po, kapapasa lang, di ba, Chair? Kapapasa nung cancer... Yes, salamat si Secretary pa nagpaalala sa akin sa buong pangalan ng ating cancer law. So, ma-assure nyo po ba na walang disruption na mangyayari sa supply ng gamot para sa programa?
May we request the OIC USEC Mirna Kabutayan?
Hello, Manang Mirna. Naimbag nga, malam Manang Mirna. Pasensya na, Sec. 3 dekada lang naman na kami magkakilala ni Manang Mirna nung nasa Cordillera pa sila. Peace movement po kami noon, Chair.
Thank you, Mr. Chair. Thank you, Madam Senator. We have different access programs. We have the breast cancer, colon and rectal, and we have childhood cancer access programs. And we have different sites of these cancer access programs. They are mostly in our hospitals, mostly DOH hospitals all over the country. We have one in Luzon, mostly the Metro Manila hospitals. We have one in Mindanao, it's the Davao area. And in Visayas, part Vicente Soto and Corazon, Locsin. We are able to procure many of the cancer medicines that are according to the standard protocol, depending whether they are in the national formulary. So we are able to use some of the drugs. We have slight problems in terms of procurement because some of the suppliers cannot deliver the quantity, or there are some requirements. Otherwise, we are uh, doing well as far as the cancer, given the tawag yan, given the budgets.
And speaking of budget, how much was allocated para sa Medicines Access Program for cancer drugs dito sa 2019 budget? At magkano yung kailangan talaga ng program for its proper implementation?
Mr. Chair, Madam Senator, the proposed budget for 2019 is 82 million for the cancer drugs based on available. It will never be enough. There is a request for the rare cancers, but we cannot be providing medicines for this.
Pero still, just to give the committee an idea, how much does the program actually need for its proper implementation? Para maikumpara lang namin dun sa 82 million proposed.
Yeah, 82 million. No, how much more do we require? If we do not address the common, this addresses the common cancers, breast, colon and rectal, and some childhood, but the rare, especially the hemophilia, will cost very much for one patient. I don't have the exact data now, but we can provide you the complete data for the other cancers, ma'am.
Salamat po. So as also to guide us as we move into the plenary debates, kung ano pa yung kaya namin gawin doon. And just as a last follow-up on the status of the bidding, may mga reports po kasi sa NGO contacts claiming na meron na daw stock-outs for some of the cancer medications for the breast cancer medicine access program. Tama po ba ito at anong nagagawa pa tungkol dito?
We are trying to move medicines where they have stockouts and where we have excess medicines. But we are trying to follow up the procurement. I think cytarabine, that 1 or 2 medicines that are being followed up, ma'am.
These 1 or 2 po na may stock out na nga po sa ngayon.
Yes, but the hospitals can provide, if they are able to provide out of their regular income to buy these medicines. And we can supplement with the budgets later.
Salamat po. Thank you, Mr. Chair. Sa ano po, third to the last question kasi. Sa first 1,000 days program po, meron po bang summary na mahihingi sa DOH or sa National Nutrition Council sa budget allocation ng para sa implementation ng programs and interventions sa ilalim ng first 1,000 days of life of the mother and child?
May we request the NNC Executive Director to respond to the query?
Thank you very much, Mr. Chair and Madam Senator. Yes, we have prepared the work and financial plan for the ECCD first 1,000 days. Admittedly, during the this year's implementation, we had a very slow start-up. By first quarter, we only reached 30% disbursement. But as of November 9, our hopefully we could use up at least 76% of the obligated amount. That is about 280 million. The delay was mainly due to the need for local governments that will implement the ACCD at the local level to convince also their local sanggunian to pass the resolution that will accompany the work and financial plan and memorandum of agreement. So as of last Friday, only 3 million of the 20 million that we're supposed to download to local governments have not been released. And these are in the provinces of Davao Occidental, which is a relatively new province that need a lot of hand-holding, and then also a number of 2 towns or municipalities within the province of Davao Occidental. So hopefully before the November, this month ends, we could we anticipate a bigger or higher utilization.
At para po sa papasok na budget, ano po yung proposed budget allocation?
The proposal for the locally funded project of ECCD is 118 million. This was a big reduction from the 300 or so million that we proposed.
300, how much, ma'am?
About 346 million for
Tama po kayo, malaking deduction po. So pag-aralan po namin kung ano properly ang maaari pang magawa. Lalo na kapapasa ng first 1,000 days.
we're also
Upscaling nutrition law for
yes,
women
we're
and
also
children up to 2
engaged
years
in
old.
the formulation of the IRR of the ECCD.
Exactly, ma'am. And good luck po dyan. And then pag-aralan po namin paano yung sa
Thank you very
budget.
much
Salamat po. Sa BHWs, one question din lang po. May summary po ba ng mga programa sa ilalim ng DOH budget na magbebenepisyo sa mga BHWs kung sa anumang anyo, whether capacity building or mobilization expenses, etc.?
Ma'am, the BHW, I understand, is being taken care of by the local government units under a fragmented health system. But of course, I believe that our regional offices do conduct human resource development trainings. And I will just have to ascertain how regularly the support that we give, in fact, in terms of capacity development, yung service delivery network as navigator and profiler, as treatment partners in TB DOTS, and as other DOH programs and projects, and orientation on the Barangay Health Workers Manual and Handbook, and of course the interpersonal communication skills development. And so these are, we have a list, we can submit it to you, Madam Senator.
Salamat po. And salamat din, Mr. Chairman, dun sa paalala ni SEC na these programs are being implemented under a fragmented system. And responding to that, in fact, yung isang layunin talaga ng Universal Healthcare Bill, including how to more efficiently mobilize our health human resources na nakabilang naman doon yung BHWs. So, salamat. Second to the last topic, hospital deposit and hospital detention. So, dalawang tanong lang po. May update po ba sa implementasyon ng anti-hospital deposit law? Yung Health Facilities Oversight Board ba ay naitayo na as provided for by RA 10932? Na-convene na po ba yung board na yon? At kung oo, ilang mga reklamo na na-file sa board?
Thank you, Madam Chair, Mr. Chairman. The Health Facilities Bureau has a list of the complaints, and we will be able to give you a copy. But it is strictly enforced, and it is a licensing requirement po, no? So every time we have a complaint, we always talk to the hospital, call them, and remind them that you cannot ask for a deposit sa emergency, and that we cannot detain a patient for not paying. And so far, most of these cases have been resolved and the patients have been allowed to go. But we will be able to give you a list of the cases that have passed through the HFSRB and the regional offices. The board has been recreated again, and we will be convening this before the end of the year with representations also, of course, from the hospitals.
Oo, salamat. Actually, I was about to ask a follow-up question pero nasagot nyo na. I was about to ask, itong bureau, ito ba yung dati ng bureau under DOH or it's really the board provided for by the anti-hospital deposit law? So it's the board.
Yes, ma'am, the board.
Okay. Ilang mga reklamo na ang tinanggap ng board na to since it was newly convened?
Ma'am, the board has not yet received any complaints. They have been so far settled at the level of the Health Facilities and Regulation Bureau. So wala pa naman pong na-elevate sa board.
O, so yun. So that's the clarification. Hindi pa talaga operational, hindi pa tumatanggap ng reklamo yung board. It's still the old bureau under the DOH. Wala pa pong nare-refer, Yusek. All right. And then, lastly, on this second to the last topic, may data po ba tayo on the cases of patients na na-detain na mga ospital? Actually, I thought you were referring to them earlier, sir, kasi sabi nyo, they have been allowed to go. So, pero itong sa kaso nga ng mga na-detain sa ospital, may data po ba tayo sa kanila? At ano nang naging aksyon ng DOH sa mga instances na to?
Thank you, Mr. Chair, Madam Senator. Yes, we do have a list of the complaints that we have received from her, ito po mga dinidetain, even po patients living or sometimes deceased. But fortunately, once we report them usually to our regional licensing officers and HFSRB, it's settled quite quickly. Kaya po hindi na rin umaabot sa board. Sumusunod naman po yung hospitals natin. And we will be able to furnish you, ma'am, a copy of all these cases from the regional offices and the central office. Pero so far po, na-resolve to sa level ng Facilities Bureau natin.
Salamat. We would all appreciate that, and I would especially because we are studying a possible draft of an anti-hospital detention bill. Last question, last topic, Mr. Chairman, tungkol sa expanded program on immunization implementation. Yung buong issue po ng dengue vaccine controversy ay di umano nag-apekto sa public confidence sa DOH program na ito. Pwede ba itong i-validate ng department? Nagkaroon po ba ng upsurge ng preventable diseases sa mga iba't ibang area ng ating bansa? Halimbawa po, may mga ulat ng measles outbreaks, yung mga magulang na nagre-refuse kahit sa deworming tablets ni hindi bakuna. So, paano po ba ma-validate ng DOH yung ganitong parang outcome, searching for the proper word, pero yung backlash sa isyong ito?
If I may, Mr. Chairman, there's a study, there has been a survey conducted by a certain academic group from London-based group that submitted the results of the survey showing that the confidence level on the immunization program of the DOH has gone down from 92% to 33%. So now we have requested the WHO country representative, through the country representative, Dr. Gundo Weiler, to fund a comprehensive survey to include and precisely validate whether these results that have been transmitted to us can be validated through a survey. But in the survey that we have asked the outfit to conduct, may rider questions for each of the immunizing agent. So, is it measles, is it BCG, DTP, hepatitis, HPV, PCV. So, meron po tayo, isa-isahin po natin para talagang more or less mas evidence-based yung to track down confidence levels for the immunization program in general and the specific vaccine in the program. So we'll give you the results of this as soon as they're out.
Thank you very much, Secretary. I know our whole committee is really concerned to work with the Health Department to restore confidence dun sa mga core programs ninyo, lalo na sa usapin ng primary health care, kung saan talagang top of that list sa lahat ng magulang, yung immunization against preventable diseases. Salamat,
If I
Mr.
may,
Chair.
the effort to bring back confidence of families and parents in the immunization program of the DOH are continuing. So, in fact, we have our supplemental immunization activities in areas where
there have been very low uptake, immunization uptake, and so my instruction is for them to just continue. I mean, given all this loss of confidence, the collateral damage that has been created because of certain controversies, notwithstanding all of that, I have given my standing orders to just sustain, if not level up, even level up and continue to communicate. And in fact, we're also rolling out our more targeted information, education, communications campaign, yung sa television, para there's going to be a much broader reach for more effective information dissemination with respect to the advantages of vaccines as life-saving public health interventions. In fact, they are indeed the next most important public health intervention after water, after potable water. So I think we really have to zero in on more effective communication to restore, to recoup the lost trust and confidence of our people. So yun po ang ginagawa natin, Mr. Chairman and Madam Senator.
Salamat, Mr. Secretary. Maraming salamat po, Mr. Chair.
Thank you, Senator Tiberos. Anyway, we only have Senator Big Subiri, our majority leader, who has some concerns. It's already 1 o'clock, and our session is 3 o'clock. So hopefully we'll finish already within less than an hour, and hopefully have the budget of the DOH be approved already before the session, this hearing, we suspend this hearing. Senator Zubiri, our majority leader.
Thank you, Mr. Chairman. I like the fair warning you gave out before I start my line of questioning. It's okay, because I can also schedule them last in this plenary if you want, and leave you there last in the plenary before we adjourn on December. But I know, you're just kidding. I'm also kidding. But my question is not policy questions, because I'm very close. I'm good friends with Secretary Duque. We've worked together in the past in now 2 administrations, and I'm very happy that he's on board, because he's very hands-on, especially when it comes to issues concerning to the department. Mine is actually more a local concern, Sec. We just turned over the rehab center in Bukidnon a few months ago, if I'm not mistaken, about 3-4 months ago, and basically with the transfer, I'm saddened to hear that we only have such a, it's such a large project. As a matter of fact, I'm asking my staff, I don't know if they're ready, to present it to you so that everybody will have a grasp on how large this project is. It's a donation given by some friends from China, friends of the Philippines. They donated 700 million pesos, 500 million on the building, and 200 million on the equipment. No cost to the government, 0 cost to the government. Even the turnover was at no cost to the government kasi kami gumastos nun. Papakain sa mga tao doon lahat. Yung lupa po ay lupa ng Malaybalay City at dinonate po sa gobyerno, sa DOH in particular, for this project. So I'll ask my staff, Jess, are we ready to show everyone this project? I beg the indulgence of the chair. This will only take a few minutes.
Go ahead. We still have until 3 o'clock.
This will only take 10 minutes, Your Honor.
Inaano ka, I'm just kidding. I'm just, this is the 3rd hearing already, so it's okay with that.
Yes. Gumagana ba, Jess? It's, I think, one of the most beautiful rehab centers in the country. Yes, it's 10 times better than the one in Camp Magsaysay. With all due respect to those who donated that. This is actually a resort-like atmosphere. As a matter of fact, I had told the President my fear. My fear is baka hindi na umalis yung drug rehab patients. Kasi ang ganda-ganda dun. Tiles lahat. Parang air condition yung kasi Malaybalay. Ayaw baka hindi umalis. Anyway, ano Jess, yung ating ba'y may sira? Projector screen? So anyway, before we watch the video that we have prepared for all of you, we only have 21 patients there, Secretary. it's really a white elephant as of the moment. Nobody's using it. It's like a ghost town. Such a beautiful facility that can cater 600 patients. We only have 21 patients there. Napakasayang. Kaya pati yung PIDEA head, when I spoke to General Aquino, head of PIDEA, he did not even know about the facility. And I said, you know, ang dami-dami ninyong natokhang, ang dami-dami ninyong pinapapunta sa rehab centers, pero we have the very beautiful rehab center in Bukidnon which caters to Northern Mindanao. It's the Northern Mindanao Wellness and Reintegration Center. And yet nobody is using it. Hindi po niya alam. So I do not know if you have someone in charge of this project secretary. Maybe do you have someone in charge of your department, maybe an undersecretary for rehabilitation, drug rehabilitation concerns?
Well, the USEC for our health facility infrastructure development team is USEC Lilibeth David. We can probably just invite her to join us here. And also, perhaps USEC Roger Tong-An can just enumerate the support that is being extended to the facility, Mr. Chairman.
Maybe also as a policy question, Secretary, as a policy question, who really runs these facilities? I mean, we have lots of rehab facilities all over the country. I think they're also focusing on community rehab centers. Sino itong papatak? Sino nagpa-funding yan? Is it PIDEA, DOH, DDB, Dangerous Drugs Board, DILG? Sino kaya yung nag-ano yan?
Thank you, Senator and Mr. Chair. Actually, with the GAA of 2019 for the Bukidnon TRC facility, we have 12 million and 6 million for coming from the LGU. And right now, the Department of Budget and Management approved 50 plantilla position for the facility. For the community base that you are referring to, Senator, this will be funded by our DILG. And they will be the one to do the community base, which we approximately 95% will be taken care of here. But the Department of Health will also collaborate with them with regards to the assessment of the patient, whether it is mild, moderate, or severe. Wherein if they assess the client is severe, that's the time they admit it to the facility like Bukidnon. So ganun po yung process natin dyan. With regards to the policy, the Dangerous Drug Board also gives the policy wherein the Department of Health also collaborate with the DDB together with the PIDEA. We have the ICAD group which convene every month for them to facilitate the policy with regards to the TRC and community base. And right now, the Department of Health is also cropping up with the recovery clinic. So that will be the different facilities for our drug surrenderers. Thank you.
Smaller scale, DILG magdadala niyan on the community-based. On the bigger ones, such as the one in Magsaysay and in Bukidnon, DOH na maghahawak niyan.
Opo.
Good.
Collaboration po yung sa community base.
Okay.
DILG together with the DOH doctors.
On the budgeting for 2019, because nilapitan ako ni Dr. Go, who's the chief TRC head there in Cagayan de Oro, who's I think he's also in charge of the Bukidnon facility. I think they'll be needing about 26 million for MOE, capital outlay, and I believe, the grand total is 26 million is the request. Do we have a budget for that for 2019?
2019, they just gave us the GAA of 12 million.
Bukidnon Rehab Center.
Yeah, for the Bukidnon Rehab Center.
So maybe
and
with
6
the-
million will come from the LGU.
Mahirap kasi humingi sa LGU kasi yung LGUs, I don't want to commit the LGUs because the LGUs, whenever you talk to them, dinonate na nga namin yung lupa. Magkano yung lupa na yun? 5 hectares at 5,000 per square meter. That's a lot of money. That's a lot of money that was donated to the DOH. So parang feeling nila, bakit pa kami gagastos nito yearly? Now, I think the initial 6 million was to help initially. But eventually, mawawala kasi the local governments also have to spend for their own initiatives. So maybe with the, I know your hands are tied, Sec, because your hands are tied with the budget that's given to you. Maybe we can ask the help of the chairperson of the subcommittee, Chairman J.V. Ercito, together with Tita Ganda, our chairman of the Finance Committee, to augment the budget. Anyway, it's for a good cause. You know, I truly believe that we must save the users, jail the pushers, and the only way to really do this is to come up with facilities wherein we can rehabilitate them. So maybe at the proper time, Mr. Chairman, I'd like to move for an additional budget for them from 12 to 26 because yan pong kailangan nila on the personnel and MOE. Kasi kung hindi, aabot lang pong 60 by the end of the year. And 60 personnel, 60 patients. 60 patients. You're only using 10% of such a beautiful facility. And you know, the numbers of being given out by the Dangerous Drugs Board and PDEA are by the millions. But parang wala naman, di naman natin mahanap yung mga i-rehabilitate natin na sinasabi na 2 million are using drugs. Sana sila. Di pasok natin sila sa mga facilities na ito para mawala na po yung problema ng droga. And that's the only way we can help the President in the anti-crime because the less that people use the drugs, the less the demand will be for these dangerous drugs. So I'm happy to hear that the DBM will release 50 more plantilla positions so that the patients will increase to 100. Pero kulang pa rin. That's only 100 patients. Why is it 1:2 ba? Pagka ganyan? I mean, 1 plantilla position, 2 patients? I see some people commenting in the back. Sir, you may join in the discussion. Kayo po ang in charge? Is the technical manager?
Good morning. Good afternoon,
Sir, good afternoon,
sir.
sir.
I'm Dr. Ivan Hois Cartin. I'm the program manager for the Dangerous Drugs Abuse Prevention Treatment Program. Generally, if it's a doctor, it's actually 1 doctor to about 20, and then for a psychologist, it's about 1 psychologist to another 15.
Yes.
And then social workers, the rest. So when we think about, for example, the 50 plantilla items, in a sense that will be a little more comfortable if you have now 100 patients. As of the moment, the people running it are only 20. Yes, and then most of them are from Cagayan. And then remember that when we started with it, sir, Senator, we got all the patients from Cagayan de Oro who are from Malaybalay.
Yes, that's right.
So it's in there, it's nearer. Okay.
Yes. I think the mayor is also pursuing more of these programs on the barangay level and gathering them for rehabilitation in the facility. The mayor of Malaybalay, I think, is very active on that now, so that it may be fully utilized.
Additional, sir,
Yes.
I think we have a guideline that generally it shows by the WHO and the United Nations data that about 0.6 to 1% of those who surrender actually would require only residential or inpatient facility.
Okay.
That goes to the treatment rehabilitations. The next is about 4 to 5% goes to the outpatient. And then we call it now the recovery clinics and maybe later recovery homes. And then the rest will actually be the community-based.
In other words, pag malala na this guy has psychological problem, the person has psychological problems already, and they're heavily into the drug that they're utilizing, then they go into these rehab centers, no?
You're right, Senator.
So hindi pa malala, pwede pa sa outpatient, community-based.
So these are dysfunctional who may require about 6 months to 1 year. So nandun siya. So there is mga dysfunctional na about 3 to 4% that who may not need actually the 6 to 12 months, but they would require there in the community. So ito, sir, yung fina-follow up natin na magkakaroon ng mga services pa additionally.
Yes, yes. Actually, it was supposed to be, honestly, it was supposed to be also under the administration of Secretary, prior to you, Secretary Re- Obial. She had recommended that it also be a mental health facility because we do not have a mental health facility in Region 10. As a matter of fact, all our mental health patients go to private institutions na mahal. Yung Happy Homes dun sa Maramag, sa Davao pa sila pumunta sa Cagayan de Oro. It's private, ang mamahal ng bayad. Hindi ba natin magamit part of the facility, Secretary? That was really supposed to be the plan of Secretary Obial. Para magamit din natin for mental health patients.
I think that's a really good suggestion, Your Honor. We'll just have to be more a bit evidence-based insofar as how the prevalence of mental illness in that region or the regions in Mindanao, make it the hub for providing mental health services. And that's to me is a perfect location. And the facility can be maxed out. Yung pong ganda at laki ng facility, talaga pong makakatulong ito.
Kasi we have several dormitories, we have medical
I was
facilities.
there. I was
Yes,
there. We
I was so
went
happy
around.
that you came over, Secretary.
We did a visual ocular inspection,
Yes.
and it's probably the best TRC that I've ever seen. And so, if there is going to be a flexibility for it to become a mental health facility, why not? Anyway, the challenges are common, and so excellent suggestion. We'll work on it.
Yes, please, Sec.
And make
Because,
the
you know, when I was a
assessment.
congressman then, I used to go around, the district where I was representing, I found so many families who probably had children with mental health issues, and even adults, who were actually chained to the poste of the house, under the house, nakahubad na and all that, kasi mental health patients siya, and they don't know how to treat them except to chain them like animals. And so, wala kasi silang pera, Secretary, to send them to these private facilities. So it would be a blessing, Secretary, if you can also redirect the, not only for drug rehab, but also for mental patients, for the region. Because it will service Cagayan de Oro, it will service Misamis, Bukidnon, and all the other areas beside it.
Just on the balance, the challenge right now is also the lack of psychiatrists, psychologists. So again, the pertinent human resource complement is even a bigger challenge than the facility itself, because obviously the facility is already there, well built, and it's very spacious. And in fact, we want to make the most out of it. But if we don't have enough psychiatrists and psychologists and the human resource complement, then we also don't want to unduly raise public expectations where, in fact, the important component of human resource is not there. But we'll work on it. We'll do assessment, Your Honors.
Maybe we can help each other, Sec. What we can do is come up with a recommendation. What would be the required number of plantilla positions? Kausapin ko na si Sec Ben. Ito na po yung video. Can we show the video? Can we show the pictures? Those facilities on the right are the dormitories. We have a hospital there, small hospital. These are the dormitories. Balay-balay is 2,000 feet above sea level, so it's like Tagaytay. It's like air conditioning all 24/7. That's the whole facility. It's 5 hectares. We have basketball courts. We have badminton courts. Yan. The gymnasium for their activities. Landscape, parang ang resort eh. That's the entry area where you inspect and get the records of the patients. Security building. These are all complete now. This was the video that was presented prior to the turnover. Of course, we're PWD compliant. I think Risa would like that idea. So, tignan nyo yan mga kapatid. Philippine-made project. And it was built after 1 year because it was privately funded. So, mabilis. Wala masyadong maraming cheche-bureche na dinadaanan sa Procurement Act. Kaya kaagad-agad, bid, bayad. It was built in 12 months. Yung kusina nila, parang hotel yung gamit eh. Yung bumili ng mga gamit, nagulat pa yung donor kasi parang pang hotel yung mga ginamit ng mga labesa, refrigeration system. Tiles lahat yan, showers. Now they are fully bed. They all have double-deck beds, all of these dormitories now, as we speak. So I guess they get the idea, Jess. Thanks. So yun lang, Sec. Sayang. I just wanted to present all of you to my colleagues. Such a wonderful facility we have. Hindi natin gagamitin mo. Sayang, napakasayang. Yeah, it was a partnership. Your team was very well involved in this with us because they had to come up with the designs. They had to agree with the designs with the architects. So that's all, Your Honor. Maybe what we can do, Sec, is that you give us a recommendation, request, like a wish list for the DBM. Kusapin at Sec Ben. Yung mga barkada naman natin yan eh. We can talk to Sec Ben and ask Sec Ben, this is for a good cause. This is not only for Bukidnon, it's for the whole region. And this will service a lot of patients. Maybe hopefully next year they might be able to increase the requested personnel that you may need, psychiatrists, mental health specialists, and all that. So you have my support, Sec. And then lastly na lang, Sec, just a follow-up, kasi yung nag-donate sa atin, they need also to present to their board, yung mga kaibigan natin, Friends of the Philippines, they have to present to their board that it was truly donated and they did not pocket the money. So there's a problem with the deed of donation. The certification of donation. They need a certification from your office that it was truly donated and implemented and turned over. I think the problem lies, according to my chief of staff, is there's still a review of your office on the deed of donation of the Malaybalay City property to the DOH. Fast track nyo na yun, sir.
How will do that? Yes, sir.
Pinamimigay na yung lupa, tanggapin nyo na. Fast track na the donation. Baka bawiin pa ng Malaybalay, magiging Malaybalay City Hall pa yan. So, if you can fast track the deed of donation, and then afterwards, maybe we can fast track the certification of donation, so that I can give it to the donor para hindi din sila matamaan dun sa kanilang board sa China.
Yeah, right now I'll be instructing our health facility enhancement program head to fast track the certificate of acceptance of the donated.
Maybe my
property.
staff can also work with your staff.
Yes, we'll do that.
Yeah, see. When you
Yusek Lilibet?
What would be the name? Ma'am Lilibet?
Yes, Yusek
Ma'am
Lilibet. She'll take care of that.
Ba't parang malungkot yung mukha ni Ma'am Lilibet? Ba't malungkot po kayo? Libre po ito. Sige, okay. So my chief of staff, si Nel Makapayag, Attorney Nel will be with them.
We'll do that, certainly.
Thank you, Sec.
Thank you so much.
This is a feather in your cap. I mean, this will be a jewel of the DOH family. Thank you, Sec.
It's for the DOH. Thank you, sir.
Thank you,
for,
Senator Subiri, our majority leader.
the
And I think,
magnanimity. Thank you.
and I think this very, very yung coincidence. So you just passed the mental health, no? So it can really service the region. So pag kaysa maging white elephant, might as well make the most out of it. At this point, the chair would like to acknowledge the presence of Senator Nancy Binay.
Mr. Chair, pwede, since we're already discussing yung mental health, I think for the past hearings, hindi ho natin na pag-uusapan yung mental health facilities na minamanage ng DOH. Meron ho ba?
Meron tayong mental health facility. Unang-una yung National Center for Mental Health sa Mandaluyong. Ito yung pinakamalaking mental health facility natin. At meron po tayo sa Mariveles.
Yung sa Mandaluyong ho, anong capacity nun?
That's anong capacity? 6,000 bed capacity ba? Mandaluyong. 4,000 bed capacity po.
Ilan ho yung 4,000 bed capacity, pero ilan ho yung pasyente ngayon?
It's over capacity.
Mga ilan nga ho yung over
Siguro
capacity?
baka 100%?
100%?
110,
So 4,000 bed
120,
capacity, 8,000
Aha.
ho yung pasyente.
mga ganun ba? Mga 8,000? Mga 8,000? Yeah. Yeah. Ilan? Here.
National Center for 82.52%, 4,200.
So it's 4,200 ang authorized bed capacity. The bed occupancy, I'm sorry, based on this record, it's not 100%. It's 82.52%. But obviously, there will be seasons na talaga overcapacity, and then may mga lean periods. No? So, hindi ho pare-pareho. So, marami ho tayo dito. Asan pa yung mga iba? Sa Mariveles.
Sa Mariveles, sir, yung mga second.
Mr. Chair, siguro Secretary, can you just submit to the...
We will do that
And
right
then,
away.
may programa ho ba kayo for next year for mental health facilities?
For HFAP, upgrading lang po, kasama po sa amin priority listing.
Hindi naman ho nakasama yan sa cut.
Hindi, baka nakasama ho ito sa
Nakasama
CAT,
din ho sa
pero
CAT.
i-restore ho natin doon sa 16 billion. So, may mga psychiatry centers, 17, 21 DOH hospitals through an integrated mental health services. So, 21 po yan, mga hospitals na yan, na kung saan ipapasok po natin yung mental health services. Para angkop po ito doon sa mandato sa ilalim ng Mental Health Act. At kung ako po ay pagbibigyan pa ninyo, ay yung pong IRR ay akin nang minamadali. Although the law says 6 months, sabi ko by January, let's bring it out. And then also the constitution of the the Council for Mental Health ay nakumpleto na po yung listahan. We're just going to, I don't know, we might have submitted it already to the Office of the President for the appropriate appointments. So, ilan po?
Senator Tiveros?
Salamat, Chair. Pahabol na lang, gusto ko lang suportahan yung ideya ni Majority Leader Migs. Talagang i-explore po natin yan kasi I really appreciate yung sinabi po ni Dr. Escartin, yung mga percentages. Sinasabi po yan ng DOH, dati pa sinasabi din yan ng WHO, na as far as problematic drug use is concerned, mga 1 to 2% of them ang mangangailangan ng institutional inpatient care or confinement, and then yung the other percentages, the good doctor mentioned, mga 8 to 9% outpatient services and 90% community-based programs. And as it happens, ganun din po yung percentages for in any population halos, pati sa ating mga Pilipino, for persons with mental health concerns. And in fact, that was the argument we were making, both nung tinatrabaho namin yung mental health law, at saka dito sa debate tungkol sa paano ba talaga natin lulutasin yung problematic drug use, na that problematic drug use is a mental health concern, and one of the mental health problems is addiction of any kind, whether sa illegal drugs, alcohol, tobacco, etc., gummy, whatever. So, I think it would be really good i-explore natin yung ideya ni Senator Migs para more of the people who would need inpatient care, kahit 1 to 2% lang sila ng buong population nila na may ganung problema, whether problematic drug use or mental health problems, ay maserbisyohan sa facility nila. As a last point lang, yung sinasabi ni Senator Nancy about the NCMH, I remember gladly na nung tinatrabaho namin yung mental health law, pati yung mga kasama nating staff sa NCMH were one in saying, we support the drive for deinstitutionalization of persons with mental health concerns. Kasi vast majority, community-based at saka outpatient services ang kailangan, and which is what we finally passed in the law, Sec. So small percentage lang would need institutionalization. Salamat po, Mr. Chair.
Perhaps just an addition to the topic at hand. The 21 hospitals I have mentioned, as part of our capacity building initiatives, we're setting up the Department of Psychiatry in each of these hospitals of the DOH so as to decongest also our National Center for Mental Health. And so I think this is a strategic direction which we will pursue.
Mr. Chair, siguro isang ano lang punto. Since napag-usapan mo yung sa Bukidnon, di ba yung sa Fort Magsaysay ho is it already under the DOH? That facility?
It's operational now. I understand.
Ilan ho ang naka-check-in doon ngayon?
1,500 residents in the Fort Magsaysay facility, TRC.
So yun naman ang nagagamit?
Yun ang nagagamit.
Yun ang nagagamit.
Pero malaki din po yun. I think 10,000 ang
10,000 ang capacity.
It's a very
So I
big
guess so baka
facility.
pwede pag-aralan nyo din yan, baka pwedeng dual purpose, baka pwede din as a mental health facility.
Yes, ma'am. I think that's a very, very good suggestion, ma'am.
Thank you, Mr. Chair.
Thank you. Thank you, Senator Nancy. Anyway, that's very nice. At least we, something very good idea that came up to make good use of the supposedly rehab centers. Kaysa maging white elephant, at least they'll be put it to good use by using it as a mental health facilities. Anyway, since my promise is 1 o'clock, so siguro hindi na natin siguro na 3 o'clock. So there's a motion to move the...
I move that there be no further questions from our colleagues so that you can also prepare the committee report for the plenary. We move to approve on committee level the budget of the Department of Health.
Second the motion.
Duly seconded by Senator Risa.
Okay, it has been moved by our majority leader and seconded by our colleagues. So the budget of the Department of Health is now approved in this committee. Pending na lang po yung pong sa HFEP. Hopefully we can restore the HFEP during the plenary. So this will be submitted for the plenary discussions, deliberations. Thank you. This hearing is now suspended. Thank you.
Thank you, Mr. Chairman. In behalf of the DOH, thank you.